I want to thank everyone for coming today. It's huge that you're all here, and it's a really wonderful thing that FSR has sponsored this conference. Because sarcoidosis can be a very lonely disease. I was surprised to see how many people raised their hands this morning at who's never met another person with sarcoidosis. So this is such a wonderful opportunity to get people together who are traveling their very own personal journey, but it's a journey that others are traveling as well. So I want to thank you all for sponsoring this event. As we're talking about depression and fatigue and sarcoidosis, it's a lot more common than we may think, and we'll get into the numbers. But what I'm going to touch on today is how we define both terms, the impact that both cause, as well as what we suspect the causes of fatigue and depression are in sarcoidosis. We'll touch on some treatments that we can offer, and then wrap up with some research that we're doing right now, as well as some research needs moving forward. Let's start with fatigue. Some of you may have felt this way. Fatigue is very common. Fatigue is not something you can see. Fatigue is something that you can feel in the core of your being. Nobody can see it for you. This is what you experience. What are some of the things you all have heard people say in a response to, I don't feel well? Yeah. You look good. Things are fine. You don't look tired. What else have you heard? You're lazy? Absolutely. If you just get out.
Get out more.
You should exercise. Actually, we're going to get to that one, but, and everyone feels down sometimes. I know anyone who's had fatigue related to their sarcoidosis has heard one of these terms. And I can't imagine how frustrating it is, because this is a condition that affects sarcoidosis patients, and it can impact quality of life. It's interesting, when we're in clinic, we assess in our clinical practice for fatigue. And I'll ask someone, are you fatigued? How's your fatigue? And commonly I'll hear back, what do you mean? What is that? You mean sleepy? And so the definition of fatigue is often misunderstood, and depending on what you're reading, the definitions vary. This is a nice broad one that we're going to work with. Extreme tiredness resulting from mental or physical exertion or illness. We're going to add to that definition in just a minute. But what's the impact of fatigue in somebody with sarcoidosis? I think it's effective if we compare it to other conditions. General population, depending on the research you're looking at, fatigue occurs in 7 to 45% of the general population. When we look at sarcoidosis, it occurs in up to 70% of the people with sarcoidosis. And it doesn't matter where you have sarcoidosis. Fatigue is one of the most common symptoms associated with this disease. Doesn't matter how active the disease is, doesn't matter where you have it, you could have some degree of fatigue. Sarcoidosis oftentimes results in more mental fatigue and higher fatigue scores than other lung diseases. And its impact can vary depending on the degree of fatigue that you're having. It may impact your finances or ability to work, interpersonal relationships, family dynamics. Oftentimes there's role changes. Maybe you're not able to do those things that you normally do at home, and someone else needs to assume those responsibilities because of your fatigue. It can increase your stress level. And of course, it can induce depression. And that's why I'm talking about these together. One can often impact the other. When somebody has fatigue, we're able to assess it specifically for someone with sarcoidosis. There's a tool that we use. Those that have come to our clinic have seen this. It's the fatigue assessment scale. This is one simple tool that we can use. It's 10 questions. This tool's been validated for those with sarcoid. And we know that a score at a certain level indicates fatigue. We also know if there's a change in that score on your fatigue assessment scale, of a certain number of points that can indicate worsening or improving fatigue. We know that it's significant. So there are tools that we can measure it besides asking, how do you feel? Are you fatigued? That's only one part of the puzzle, okay? The causes of fatigue and sarcoidosis vary, and this is important because we're going to treat based on what's causing it. We don't need to ignore some of the metabolic abnormalities that can cause fatigue. Things like diabetes, things like anemia, thyroid dysfunction. If we're treating you with prednisone or something else for your fatigue and it's being caused by anemia, it's not going to do anything. So we need to assess for some metabolic problems. You may also have depression or anxiety, which is resulting in fatigue. Another source of fatigue in sarcoidosis patients is fatigue directly related to the disease itself. So folks that are having small fiber neuropathy that Dr. Moss just talked about oftentimes will have a high degree of fatigue. Sleep apnea, cytokine release, those inflammatory biomarkers start circulating through your system, and we think that can result in a high degree of fatigue. Has anyone ever had the flu? Did you feel like a wet noodle? You know, sarcoidosis, when it's super active, is almost like that condition. You're not infected, but there's so much inflammation, and it can result in fatigue. And also granuloma formation, we think, can result in fatigue. Fatigue can also be caused by the treatments we use to treat sarcoidosis. Long-term prednisone use can result in fatigue and muscle weakness. We can also induce fatigue with methotrexate. Now, not everyone on methotrexate is going to have fatigue, but we do see it, oftentimes in the day or two following their therapy. So fatigue can have a variety of causes, and it's so important for us to get to the bottom of what's causing it so that we can offer the appropriate treatment. Treat the underlying cause of fatigue. We're going to correct metabolic abnormalities. If your thyroid is not working well, we need to fix that. If you're anemic, we need to fix that. We need to treat underlying depression or anxiety if that's the root of your fatigue. We may consider medication changes. If you're on methotrexate and you can't get out of bed for 2 days after you take it, we need to put you on a different medication. Rehab, cognitive and behavioral therapy, there's some new data out there showing that rehabilitation improves fatigue scores in patients with sarcoidosis that have fatigue. Sometimes we need to add medication to help with fatigue. Those medications are going to include drugs like Plaquenil, infliximab. Sometimes we'll use a stimulant like Adderall. We'll need to check your heart function first, but there are medications out there that may help. However, not everyone with fatigue is going to need one of these medications. We need to assess the cause. Okay? It's interesting. The level of fatigue, it's been looked at as it doesn't always correlate with disease activity. If we were to put you through a PET scanner looking for disease activity, we might not see your lungs light up, but you can still present with a very high level of fatigue. It's very difficult to assess. Moving into depression. Depression and fatigue, as I said before, go hand in hand at times. This particular definition that I've chosen is from the American Psychiatric Association. You know, depression symptoms can affect not only how you feel and think, but how you handle everyday activities. In order to diagnose depression, we usually leave that up to our colleagues in our multidisciplinary care, but symptoms need to persist for at least 2 weeks. And it's a litany of symptoms, and you don't have to have all of them. Dear golly, I hope you don't have all of them, but if one or more of these symptoms is present persistently for 2 weeks, we need to have you evaluated for depression. Again, we have depression and sarcoidosis, but let's compare it to other disease states. In the general population, everybody in the U.S., depending on what you read, depression occurs in 2 to 6% of the population. In somebody that has emphysema or COPD, we see it about almost 30 to 50% of that population is going to have some degree of depression. Depending on what data you read again, in sarcoidosis, we see it up to 60% of the patients having some degree of depression. 4 to 60% of the patients. Some of the predictors of depression and of depression in sarcoidosis patients include being female, poor access to medical care, your level of shortness of breath or dyspnea, the severity of the disease, the severity of organ involvement, and if you've had this disease for a longer duration. Any one of these things doesn't mean you're going to get depressed, but these have been associated with a higher degree of depression in the sarcoidosis population. What causes depression in sarcoid? Many things. As in fatigue, it's not one single factor. And it's not entirely clear what causes depression in sarcoidosis. It's been postulated that this inflammation may result in an impairment in your psychological and cognitive functioning. This fatigue that you have from sarcoid may hamper everyday coping skills and social contracts that we talked about before that can result in some depression. We also know that when sarcoidosis develops at a younger age and turns into a more chronic process, this can be very burdensome and affect coping skills, resulting in some degree of depression. And then steroids, my goodness, we love prednisone as much as we hate it. It can trigger depression in patients, and it can make it worse in folks that already have depression, okay? So the causes are varied. So how are we going to treat depression in sarcoidosis? Well, we're going to try to treat the underlying cause. It may be a referral to psychiatry or counseling. Again, in a multidisciplinary sarcoid clinic, you ideally will have access to ophthalmology, dermatology, neurology, psychiatry if needed. This is a disease process where it takes a village. So we might refer you on to psychiatry or counseling to help with the diagnosis and the management. And that management might involve antidepressants, and that's okay. There's also some new research showing that physical training seems to reduce fatigue and depression scores in patients with sarcoidosis. So I laugh thinking about that first little flip through about what do people say about you're not feeling well, you should just exercise more. There might be something to it, but it's not a lazy factor. We actually think that might have an impact, but that's not the only thing we need to do, of course. So their treatment for both fatigue and depression and sarcoidosis is going to be dependent on the cause. In terms of research, we really have a lot of needs. We need to develop better instruments to evaluate for both. And when we use instruments like the fatigue assessment scale and the PHQ-9, those are just pieces of the puzzle that are you. We're not going to treat a number. That's one small piece of the puzzle that is you. But we need better tools to measure these things. We need to better analyze the effects of both depression and fatigue on health and economics. We need better therapies for both, quite frankly. And right now at UAB, we're looking at the relationship between biomarkers, serum levels of inflammation, and fatigue. That's an ongoing project that we have right now. But fatigue and depression and sarcoidosis are real, and they warrant our attention. Summary. They're real. These are real things. It's not in your head. It's not in your head. These two things impact patients with sarcoidosis greater than the general population. We see it a lot more. It can have a profound impact on your quality of life, depending on the severity of either one. Both can be measured, and in most cases, both can be treated. So please, please, please don't keep it to yourself. Sarcoidosis is something that you have. It is not something that should have you. So I want you to keep that in mind when you see your clinician next. Please speak up. Thank you.
Thank you so much, Lanier. With the next section, we get to put these guys on the spot and ask all the questions that you may or may not be able to get answered when you're in the clinic. We received a tremendous amount of